use of antibiotic prophylaxis in dental practice is not common. However, there are certain instances where their use is required in invasive treatments involving manipulation of gingival tissue of the periodical region of a tooth. Appropriate use of antibiotic prophylaxis. Patients with cardiac conditions, prosthetic cardiac valve, prevalence of recurrent infection, endocarditis, congenital heart disease, cardiac transplant patients with valvulopathy, consider consultation with a primary physician for immunosuppression secondary to neutropenia, cancer, chemotherapy, or solid organ transplant, sickle cell anemia, high-dose corticosteroid use, poorly controlled diabetes, disease of autoimmunity. Types of antibiotics: tetracycline, cycline sulfix, doxycycline, tetracycline, protein synthesis inhibitor, binds to 30-second liposomal subunit. Blood test antimicrobial spectrum, bacteriostatic. Carbapenems, name suffix, meropenem, beta-lactam inhibit cell wall synthesis, bactericidal. Penicillins majority have a silane suffix. Beta-lactam inhibit cell wall synthesis, cross-allergenic with cephalosporin. Penicillin is chemically related, so the immune system might see them both as the same if the patient is allergic to either one. Bactericidal. The following are specific types of penicillin and their associated characteristics. Penicillin V oral administration, penicillin G IV administration, amoxicillin broad spectrum. Augmentin included amoxicillin and clavulanic acid works against beta-lactamase resistant bacteria. Carbapenicillin for use against Pseudomonas, Monobacterium M. suffix, Atrionom. Beta-lactam inhibits cell wall synthesis, bactericidal. Cephalosporin, Ceph prefix. Beta-lactam inhibits cell wall synthesis, grouped into generations based on their spectrum against specific bacteria. The first Xan cephalocin, Xan cephonicis, third Xan ceftriaxone, fourth Xan cefepime, bactericidal. Fluoroquinolones, fluoxacin suffix is common. Ciprofloxacin, DNA synthesis inhibitor, bactericidal. Sulfonamide sulfur prefix, sulfizolazone, folate synthesis inhibition, results in folate deficiency that impacts DNA synthesis, bacteriostatic. Macrolides, thromycin suffix, azithromycin protein synthesis inhibitor, binds to 50 zinc ribosome subunit, bacteriostatic. Glycosamides, mycin suffix, clindamycin, lincomycin, protein synthesis inhibitor, binds to 50 S ribosome subunit, bacteriostatic. Medical prescription of antibiotics will vary with each patient based on their age, medical history, current medications, and other factors. Rx for infective endocarditis prophylaxis. Patient first choice: amoxicillin 2 grams 60 minutes prior to treatment. During amoxicillin 50 mg per kilogram 60 minutes prior to treatment. Penicillin allergy, azithromycin 500 mg 60 minutes prior to treatment. Children and penicillin allergy, azithromycin 15 mg per kilogram, 60 minutes prior to treatment. IV ampicillin 2 gram, 30 minutes before treatment. Children IV ampicillin 50 mg per kilogram, 30 minutes before treatment. Prescription for Rx for prosthetic joint prophylaxis. Antibiotic prophylaxis before dental treatment is no longer recommended for prevention of prosthetic joint infections according to the ADA. Side effects. Knowing the side effects of antibiotics is not only important for general knowledge, but it is also important when it comes to prescriptions. For example, it is best not to prescribe tetracycline to the patient with liver issues. Side effects: Pseudomonas colitis, clindamycin, superinfection, very broad spectrum antibiotics, aplastic anemia, chloramphenicol, liver damage, tetracycline. Drug interactions. The following drug combinations are not recommended and should not be prescribed: bactericidal and bacteriostatic drugs. Bactericidal kills bacteria when they are rapidly growing. Bacteriostatic drugs inhibit this rapid growth. Drugs cancel each other out. Antibiotics and oral contraceptives. Antibiotics suppress normal gastrointestinal flora involved in the recycling of active steroids in the contraceptive. Penicillin and probenecid. Probenecid alters renal clearance of penicillin. Tetracycline antacids diarrhea. Antacid and diarrhea reduce absorption of tetracycline via calcium ion binding. Broad spectrum antibiotics and anticoagulants actions are enhanced. Drug concentration. Tetracycline concentrates well in gingival clavicular fluid. Clindamycin concentrates well in bone. Antiviral, antifungals. The following are common antivirals and antifungals prescribed in dental practice: acyclovir, fasciclovir, antiviral used for herpes, fluconazole, azole, antifungal used for candidiasis.